war veteran suffering from post-traumatic stress disorder is calmed and guided to the support services that will help him.
How long do you think I'm gonna be here?
A nurse comforts and cares for a young mother stricken with cancer, who is coming to terms with the seriousness of her condition.
My daughter's birthday is this week.
These are not actual events captured on video or scenes from a daytime soap opera. This is HealthCAST, a groundbreaking partnership at the University of Hawaii at Manoa between the Department of Nursing and the Department of Theater and Dance.
Do you ever talk to her about this?
Theater students play the role of the patients in extremely realistic simulations, giving nursing students the opportunity to practice providing care in emotionally charged situations.
How's the back there?
There are certain simulations where you really need that human factor, the psychosocial ones, the death and dying, our anxiety, our stress.
For theater, it was a great opportunity to give some of our students the chance to really work in depth on characters.
It all takes place in the nursing department's state-of-the-art Translational Health Science Simulation Center. Nursing faculty and staff say the theater students add a critical dimension of realism.
Is a quick assessment, okay?
When we had our actress, Kyle, portraying this patient who was really going through this life crisis, we had people actually crying.
We never know what situation we're walking into, what kind of people we're dealing with, how they're going to respond to our care.
Sorry.
You learn how to respond to their emotions and how you respond to their emotions, so that way when you're in that situation you deal with it better instead of being like, oh no, what am I going to do now?
To make the simulations as realistic as possible, each theater student works with an expert from the nursing department to master every detail of the illness they are portraying.
In order to fully understand emotionally and physically what these patients are going through. So I felt like that was essential to the role that I'm playing.
The theater students say that their HealthCAST roles come with more responsibility than a typical theater production because they are working with future nurses.
Not only do I have to do justice to the character and my acting, but I have to help their education, and I need to make sure that I'm doing the best I can so that they get the best education they can.
Because the simulations are so realistic, the nursing students say they learn things that could never be taught in a textbook or lecture. They also receive critical feedback after each simulation, allowing them to build competence and confidence, along with empathy and compassion.
You've been through the scenarios, you've seen how other people respond, and from there you kind of figure out how to approach the situation, and that makes like the biggest difference in the world, I think.
The program is also very important to the theater and dance department.
This collaboration could really be the start of a new area of theater and the arts and its involvement in the world.
So your blood pressure is a little bit on the lower end.
HealthCAST is an example of what's possible when two completely different university departments join forces to achieve a common goal, giving students the most complete and best education possible.